Thank you, Usha. Really appreciate the introduction. And I must say that, the picture that you saw that was around 10 years ago, I look much younger now. So, so first of all, I don't know if you guys know the real definition of the word symphony. The reason I say that word symphony today is because I call it the orchestra. So for the orchestra to play well, for us to enjoy the music well, even the slightest of the violin should be in sync. So I do want to thank Bhaskar, Usha, and the people sitting out there to synchronize themselves and orchestrate this show to a point where many of us speakers are able to successfully show what we want to show and tell what we want to tell. So thank you, everybody. Great job, really. So the other thing I do want to mention is I want to thank Optum's human capital who made this decision, Akshay Sabharwal and Sunil Dugar in particular, to be present in this forum and to represent UnitedHealth Group and Optum. And if you guys have any questions, if you want to know more about who we are, what we do, and how best we can align our opportunities together, there's a booth out there. There are people from Human Capital Department who are going to be very, very happy to serve you in many ways in terms of providing the knowledge that you want, and also probably walking with you the journey that we walked for many years. Having said that, the way I thought the best use of our time here would be, I've classified this whole 30 minutes into 3 sections, if you will. The first one is a little bit of the company that I work for, UnitedHealth Group and Optum. The second part is about the context, which is US healthcare. And the third is why we are here, in the sense to reflect upon the analytics side of the shop. These are the 3 things that I had in mind to walk you guys through. And if time permits, I do want to reflect upon some of my initial thoughts because I had fantastic conversations. Thank you, Bhaskar, for kind of doing a little session with a lot of my co-colleagues here and also partners. Good discussions, and I heard some of us say that it's always important to serve the client. It's also important to understand what the client wants and what the client is looking for. Well, I was in that shoe for many years. So given after the presentation, if we have the time, I want to share that perspective in terms of what the client thinks, what you can deliver, and also what you think you can deliver. So there are 2 different aspects to this. So having said that, Optum is, I'll probably be coming across extremely passionate about the company because I worked for almost 7 years there, and I'm extremely proud that I work for them. What you see here is this whole transforming health information into intelligence. I do want to give a quick synopsis of what the company is. I'm going to take a pause of 5 seconds for you to take a look at what this company is. Yes, we are bigger than Coke. Yes, we are bigger than Pepsi. Damn it, we are bigger than Microsoft. Just Optum. Forget about UnitedHealth Group. It's not arrogance. I think it's the pride. It's the pride that we take to do a simple business, which is our motive. Is this the pointer? Yeah. So, yeah, there it is. Helping people live healthier lives and helping to make the health system work better for everyone. That's the pride that we thrive on. That's the business that we are in. That's UnitedHealth Group and that's Optum. I don't want to run through the numbers because the numbers do speak for itself. We are ranked 6th on Fortune list. That itself is commendable. A little synopsis of, we talk about India and, what do you guys do in India? This is Optum Global Solutions, which is based out of India, and that's the footprint to kind of give you a perspective of how big we are. Again, I'll take a pause for 5 seconds for you to consume that slide. right. I love this slide. The reason I love this slide is because this is what exactly Optum does. Look at the numbers and the sheer volume. I believe each one of you who are sitting in this room are such crazy, very crazy about data. Just, can you even fathom, the level of data that we are talking about? Just imagine 4 out of 5 US hospitals. Optum caters to 4 out of 5 US hospitals. That itself is huge. Just to kind of give you a perspective of how big and how massive our operations are in the US. And now, finally, I think one of the things that I do want to reflect upon, again, what I'm doing right now is switching from what Optum and UnitedHealthcare, which is the second part of our conversation, which is the context. And I said the context is UnitedHealthcare, US healthcare. So when we talk about US healthcare, I think right now it's a very changing and a very dynamic world out there. And I think 2 things are predominantly, I think, taking the front stage. The first part is the consumer is very sensitive about health information and how health is being perceived and how healthy this person wants to be. Because of course there's a lot of information. I don't know if you experienced it. I have experienced it in my life. When you want to know something, you do google.com, and believe me, you're bombarded with I don't know how many, and you don't even know what's right, what's wrong. So that's what this whole consumer is going through about health. We all have some or the other issues. We type Google, hey, I have a headache. Just do that, and you will have like numerous solutions. What do you really engage with? What do you take for yourself? So I think that piece is pretty critical. That's the consumer, which is slowly trying to be more, I would say, polished in a way from a thinking perspective. And the second is we all have this whole, I'm paying X. What am I getting? I'm paying X dollars or rupees to you. What am I getting in return? I think that's just a common theme with a lot of speakers here. They said, ROI and all of that. So I came across, I don't know if all of us know the SMAC. We use that quite often. I thought it's a good idea to kind of put that together. In enabling, so basically what we're saying is that at the end of the day, if you really look at it, we are really trying to bridge from a US healthcare. We are trying to bring in a better experience, value for money, and that's how we're saying that, the social media and all of that is going to help us bring that value for the US healthcare per se as a market. So, given all that, given all this, we said there's a big change agent that is required, and Optum is that company that brings in that phenomenal change that's required. And that's the reason this slide really kind of gives you, I would say, a little bit more perspective on the cycle, if you will, in terms of we have the people, we have the technology, we have the data, and then action. I think we spoke a lot about the action point of view in terms of what is an insight, how does that transpire to an action? This is action. I'll pause maybe 7-10 seconds here because this is action. And guys, I've seen a lot of people taking pictures of these. I would highly encourage you to go to optum.com. All of this is available there. The quality of the picture is going to be much better. I can promise you that. So go for it. No offense. This is all public information. There are pieces that I'm going to speak that's confidential for this forum, and that's pretty much it. So I don't know how many of you know this. Triple aim. We talk about healthcare, US healthcare. If you don't know what triple aim is, I would say you don't even know the beginning of healthcare. This is triple aim. Available at google.com. Just do triple aim. You'll have more beautified pictures of this. So fundamentally, the reason why this slide is the most important is because everything that you do in healthcare, everything, even if it's a report that you publish, think about how it's going to serve the purpose of AAA, period. Starts there, ends there. So if you have any discussion with any of your vendors or any of your business partners or any of your colleagues, the first question that you want to probably know and understand is whatever they're doing, how is it impacting any of these three? That's what it is. So I just want to make sure that we understand the context before we getting into the details of what analytics can do and what analytics will do and things like that. This is the context. To understand whom we serve and our purpose is more critical than doing what we do. You will be able to do it well if you know the purpose that you're solving or purpose that you're serving. So these are fancy words that people use in healthcare, and this is a segue to go into the analytics side of the shop. Population health, patient-centered care, pay for performance. I mean, if you have not heard of it, please be updated. These are terms that have been used for the past decade. Not today, but past decade. So who are really influencing all this? I mean, what is making the healthcare say all these words? It's just these three. The cost of care, I feel, is the predominant one, which is really driving, everybody to, march in a certain direction. The second piece is, of course, people love to call the Patient Protection Affordable Care Act, PPACA, as Obamacare, and he loves it. That's the federal reform. So there are reforms that really force the marketplace to take certain actions in the U.S. And I'm going to touch upon one of the reforms that impacted a lot in 2010, and that came instantly. I didn't plan for it. And I would want to extend that in terms of how analytics played a role or how actuarials played a role, pivotal role to define how you quantify a risk. So I'm going to give that example in a little bit. And the last but not the least, it's all online. Go and check the aging population of the United States. So we all know as you age, you need care. And believe me or not, that care is expensive, irrespective which country you live in. So these are the three influencers, in my opinion, that are changing the marketplace. Now, when we talk about all this, the question is, now this is where we get into analytics. When we talk about all this, we talk about the context, we talk about US healthcare, we talk about AAA, we talk about all that. Why are we talking about all this? What are we trying to do? Where are we going towards? We are going towards creating we are moving towards creating value. Value for whom? Well, the first answer is the customer. Well, the right answer is value for everybody. If you're in the business, you don't want to do business if there's no value for you. If you don't see profits, are you going to be doing business? Even not-for-profit organizations have to survive and bootstrap. So it's all about that. We are moving towards a world where everybody is asking for a value. And that's where the Optum analytics come into play. I'll take a pause. There's too many words there. I'm not too wordy about things, but I'll pause for 10 seconds for you to consume that, and I will talk through that. And this is also available online, so please go to optum.com, and you will get this information. And the quality of the picture is going to be much better, trust me. So, the bottom line is, we all talk about the outcomes. What is the outcome of, is it okay if I just walk through? Okay, perfect. It's just that the spotlight is right on me. So I think wow, this technology works, right? That's the idea, that I could talk through being among you. So one of the things is, we all talk about this outcomes. And one of the things I do want to lay out is, if you don't get the context, if you don't understand the business, there is no point for you to even get to the second part of the picture, which is expertise and insight. Insight does not come from looking at data. Insight comes from knowing the data. If you don't know what the data is, if you don't know what the data is telling you, wake up call. You cannot provide an insight. So when people talk about insight, it's very important to understand the context, which is healthcare. In our case, we're saying that there's an analytics platform. I cannot disclose a lot of that information, but there is a lot that goes with so much of data that we do at the back end for Optum. And all of this is triggered to that word that I mentioned, which is value. We're all trying to generate this whole thing value. Now, this picture that is going to come across is again available, and this is a product that we have catered. So if you really look at the US healthcare, pretty much 4 different categories. The first category is the guy who gives the care, which is the doctor, which is called the provider. The guy who gets the care, which is the member, which is you and me. And the guy who manages the risk, which is a payer, which is UnitedHealth, which is a payer company like Humana, Cigna, whatever. And the fourth, which is very important, is the government. The government plays a very critical role in US. Given all that, we came up with this product, which is pretty old, called OptumOne. And I'm going to showcase one of the best, I would say, state-of-the-art platforms for analytics that you could ever imagine. Now, that's the 2 words, right? Analytics is all about those 2 words. You have the knowledge, what is the action that you're taking? And this is that platform. I'll take a pause and give you the time to consume that. And my request is, I would love to take questions on these, and if you have any questions, pen them down. Very happy to answer those towards the end of the session. And I was told that the shorter you keep the session, the more you could invite questions, and I'm all about that. So I want to keep it as short as possible for you guys to ask me questions. I mean, a simple question is, hey, tell me this whole Optum Care coordination, what does that do? Would love to answer that question. Because at the end of the day, somebody mentioned, as one of the previous speakers said, that it's all about ROI. How do you get to a point that every dollar that I invest in this technology, how is it helping me to get my costs in control? And in the morning, AIG said it's all about risk mitigation, risk management. Absolutely correct. It's all about how do you manage your costs. And analytics play a pivotal role in managing costs, a pivotal. You guys who are so talented have no idea how you're going to transform the world in the future, at least from a healthcare standpoint. All right, moving along. So we're saying that it's seamless integration. Again, this is a little bit of the product. It's seamless integration. If you are a provider, this product is a provider-based product. If you are a provider, which is a doctor, you definitely want to know, hey, tell me what's going to cost me the most money? What's going to cost me the most money? And that product is going to tell you what's going to cost you the most money at the fingertips, on your cell phone, if you will. So pretty much what we're saying is that if you want to learn more about this product, feel free to go there. It's up on the website. It's one of the best, powerful analytics tool that I have ever come across in my career. So if you're passionate about analytics, go there, learn more about OptumOne, and that will tell you how powerful that tool is. Well, it's a software, This is what we talk about data, the number of transactions that happen in claims. I would say just read this. We're talking about 1.4 billion diagnoses. I mean, billion in a month. And this data is old, very old. So just imagine this, that I get a hospital on the platform. Just imagine the quantum of data that I deal with day in and day out. So we talk about big data and, Hadoop. I have always been an advocate of technology, but I've always said this time and again. Technology is, will, and forever be an enabler only. you have to tell the technology what to do. For you to tell the technology what to do, you should know the business. And if you don't know the business, well, God help you. You would not even know what you're doing and where you are. So it's important to really understand that. Now, there's a case study that I wanted to kind of bring up, and this is about clinical performance and pretty much the population health. I think one of the things that, and this is very close to a personal experience too. So it's 6 p.m. in the evening, and my kids, my wife, everybody's getting home, and we're trying to kind of fix dinner, and 8 p.m. the dinner is done, 9 p.m. the dinner is done, and now we're trying to go and put the kids to bed. Within that span of time, my wife has a big rash on her hand. And I'm trying to relate to this psoriasis here. So a big rash, which is red, and now you get all freaked out.